right, so we are going to start with the shoulder exam. As part of the shoulder exam, we're going to do a neck exam also because a lot of our patients will have shoulder pain, but it's actually coming from their neck. And so to start off this exam, we're going to have our patient do some range of motion. So our patient's going to start with neck range of motion, and she's going to put her neck into flexion or bend her chin down towards her chest, and then neck extension or look all the way up towards the ceiling. We can have our patient work on lateral motion, so putting their ear on each shoulder, and then also rotational movement where they put their chin on each shoulder. So now we've made it through range of motion of the neck, and then we can do range of motion at the shoulder. So for this, we can do flexion at the shoulder, where our patient brings their arm up all the way up over their head. So forward flexion, they can go back into extension or behind their back. You can do abduction out away from the body. And then we have a couple ways to do internal and external rotation. So our patient can do external rotation behind their head and internal rotation behind their back. And they can also do it in the horizontal plane. So internal rotation coming towards the stomach and then external rotation moving away from the body. So this is all of our range of motion at the shoulder and the neck. Other things that we can do for patients when we're assessing them is going to be palpation. So a few important spots that we can palpate, starting at the SC joint, palpating across the clavicle, all the way across until we get to the AC joint, right on top of the shoulder. We can come down in front of the AC joint and palpate that biceps tendon. You can also palpate the attachment of all the rotator cuff muscles out here on the greater tuberosity of the shoulder. You can palpate other muscular groups in the shoulder as well, or up into the neck, like the trapezius, or down the scapular border. So we've inspected our patient, we've done range of motion, we've palpated. We could do some general strength testing as well. So testing just general flexion, where the patient puts their arms straight out in front of them and then lifts up towards the ceiling as you push down on them. You can also assess just general internal and external rotation strength, and we would do that by having the patient push our hands together for internal rotation and apart for external rotation. You can do abduction as well, so we'll have the patient lift their arms up and lift up towards the ceiling on both sides. So then we'll move into our special test, starting with the neck, since we started with neck range of motion. For this, we're going to do Sperling's test, which looks for radicular neck pain that would radiate down into the upper extremity. So we're going to have our patient look up towards the ceiling, and then we're going to rotate her head towards the affected side, and I'm going to apply an axial load or press down really hard on the patient's head to see if we can recreate those symptoms for them. You can also do that in the opposite direction, and again, applying an axial load. So that is Sperling's test. We're going to do our 3 tests for rotator cuff pathology. We're going to start with empty can, which tests the supraspinatus. So we're going to have our patient bring her arms up out to her sides, kind of coming at a triangle and then turning the thumbs down towards the floor. And then you, as the physician, are going to provide a force here, and she's going to lift up and away against me, and I can repeat that on the opposite side. So the next test is looking at the infraspinatus, and we're going to test resisted external rotation. So same thing, we're going to have her here with her arms at her side, and she's going to externally rotate or press against my hand. And then our last test, we're going to look at the subscapularis, and for this we're going to do the lift-off test. So our patient is going to put one arm behind her back and then lift it off of her back. Perfect. If your patient has weakness with any of these tests, we would be concerned about a rotator cuff tear. If they have pain, then maybe just concerned about rotator cuff tendonitis. We have 2 rotator cuff impingement tests. These are both passive tests for the patient, so I'm going to bring her arm up here to 90 degrees and her elbow to 90 degrees, and I'm going to forcibly internally rotate her arm looking for pain here at the shoulder for rotator cuff impingement. So that's Hawkins test. And then our other rotator cuff impingement test is Neer test. Here we're going to forcibly adduct the arm towards the ear. Again, looking for pain or impingement at the rotator cuff. So those are our two rotator cuff impingement tests. We have a test for our biceps tendon. This one is called Speed's test. We have the patient arms straight out in front of them like they're holding a tray. And then they're going to lift up, and you're going to provide a force here, looking for pain along that biceps tendon. And we have another test for AC joint pathology, maybe some AC joint arthritis. This one is called the cross-body adduction test. I'm going to bring the patient's arm up in front of them. This is a passive test for the patient. Bring their arm across their body. You can see my opposite hand is right here on the AC joint. So as I bring her arm across her body, I'm going to ask her if she has pain where my fingers are underneath her AC joint, which hopefully she doesn't today. And those are all of our shoulder special tests.